Hello everyone. In this video, we will look at the difference between piles, fissure and fistula. Let us look at them one by one. Now, as you can see, piles or hemorrhoids, these are swollen vascular cushions in the anal canal, and these may be internal, external or interno-external variety. The piles are usually located either inside the anal canal or outside the anal canal or both, which we call interno-external. They appear as swollen, soft masses of tissue which are prolapsing outside the anal verge. These are associated with pain which is mild to moderate pain, and only when it gets thrombosed or infected, then the patient has severe unbearable pain. The bleeding associated with piles is usually painless and bright red in color. Patient complains that there is bleeding during defecation and the blood is not mixed with stool. On examination of a patient of hemorrhoids, you can see dilated veins or masses which are prolapsing out of the anal verge. The complications that can occur are thrombosis, in which we are seeing a dark colored mass. It may get strangulated, or there will be complication associated with bleeding. Treatment principles for hemorrhoids are to increase the fiber intake, to support stool softeners in constipation associated patients, sclerotherapy, rubber band ligation, hemorrhoidectomy, laser, etc. are some newer options that can be implemented. Now, let us move towards the next condition, which is fissure. A fissure is nothing but a tear in the anoderm. Usually, it is seen in the posterior midline. However, it can occur anywhere in the anal musculature. It can be due to trauma due to the mucosa as well as due to foreign object. Therefore, a fissure is a tear in the mucosa of the anoderm of the anal canal. It can usually be seen in the posterior midline as well as anywhere else. The appearance is like a linear tear of the tissue, and sometimes we will see that there is a sentinel tag or skin tag at the edge of this fissure. The patient complains of severe pain during defecation, after defecation, and lasts for few hours after defecation. It is usually not associated with bleeding, and occasionally the patient complains of presence of streaks of blood on stool. Associated with defecation, patient has pain during and after defecation. On examination, you can see a visible tear or exposed fibers of the anal canal on per-rectal examination. Complications such as a sentinel pile mass, a hypertrophied papillae, or a formation of a chronic fissure can occur. Patients are managed on conservative lines and given stool softeners as well as other materials for managing the pain. Patient can undergo surgical interventions such as lateral internal sphincterotomy, manual anal dilatation if it is associated with anal stricture. The next condition is fistula in ano. Now, a fistula is nothing but it is a fibrous abnormal tract that is formed with an internal opening in the anal canal and an external opening on the perianal skin. So the site of it is between the anal canal and the perianal skin with a tract going through it. It has an external opening which may be present and show discharge coming out from that site. Usually these kind of patients do not complain of any pain unless it is associated with an abscess or a acute infection. There is presence of pus discharge from the external opening on multiple occasions. However, patients do not complain of bleeding. The pain may be increasing during infection or abscesses, like I said. On examination, we can sometimes spot the internal opening or an indurated tract or cord-like tract can be felt on palpation. It can be also be probed under anesthesia to find the internal opening. Complications such as recurrent abscesses, continuous discharge from the opening, as well as formation of high anal fistulas can happen. Patients usually undergo fistulotomy or fistulotomy as a treatment principle. Patients can also be undergoing ceton treatment or for placement of a Kshara in complex fistulas. Let us quickly memorize. So piles is prolapse. It is associated with itching. There is presence of lump. There is easy bleeding and a soft mass which protrudes from the anal verge. Fissure is associated with fiery pain in defecation. It can have a sentinel tag. It is associated with a streak of blood. There is presence of an ulcer or tear, and there is rectal pain, which is excruciating. Fistula is a fibrous tract which is formed after an infection with the opening which is present inside as well as outside. There is a fibrous tract which can be palpated. There is underlying abscess. There is leakage of pus and involvement of the anal sphincters. Follow for more. Thank you.